Good evening, one and all. We welcome you all to the third webinar of IAPWC West Bengal, which is on preventive oncology. Today, we have the speaker with us, Dr. Sayantan, as well as our moderator, Dr. Satabdi. So, with no further delay, I would like to give the stage to Dr. Satabdi. So, Dr. Satabdi, please take over.
Thank you, ma'am. Uh, Good evening, everybody. Today, Today we all are here for a webinar about preventive oncology. Uh, this is organized by District North Chobish Pargona and our women's cells, and this is our third webinar. First, before hand over the mic to our respected speaker, I would like to thanks our women's cell head, Dr. Tanushree Bhattacharya, madam, and our IAP secretary, Dr. Arindam Shet sir. Sir, would you like to say something about our webinar?
Thank you very much for inviting me for this oncology webinar. I hope Dr. Sayantan is a very good speaker.
Yes.
And he is working in this oncology field for a very long, give a nice benefit to the participants. And my best wishes to the organizers and to the speaker also, and all the best for this webinar. Thank you.
Thank you, sir. I would like to again welcome our Women's Cell Branch Head, Dr. Tanushree Bhattacharya, madam. Madam, I would like to have some words from madam. Please, ma'am.
Thank you, Dr. Shatabdi, and thank you for inviting me and joining us as a panelist. We know Dr. Shantanu Chaudhary is a very good speaker since long, actually. So we are fortunate to have you here, and we wish it will be a very great, successful webinar from everyone. Thank you.
Thank you, madam. Not wasting much time, I would like to welcome our respected speaker, Dr. Sayantan Chattopadhyay. I would like to say something about him. He is pursuing his MPT in orthopedic. He has long 15 years of experience, and he is with Tata Medical Center since 2012. And now he is a senior physiotherapist of this Tata Medical Center. So we will honored, sir, to welcome you. And I would like to give the stage on our respected speaker, Dr. Sayantan Chattopadhyay. Thank you.
Thank you. Thanks to the entire team for organizing this. And so without wasting time, let's go straight into the topic. So today's topic is very interesting, and everybody should know about this topic, because it would be very helpful for you, for your family too. So this is a unique topic. I don't think been discussed here or elsewhere. So this is about preventive oncology. We know about the cancer and its devastating effects on human body and mind. But thanks to the entire medical team over the decades, it has the cancer treatment and its progression is very much it's advanced like anything, and many of the cancers we don't know. Many of the cancer is treatable now and completely curable now if diagnosed earlier. So we'll come to know about this, and few of the cancer we can actually prevent it if we take proper measure from the beginning. Let's start. So first question we can ask that whether the cancer is preventable or not. So actually, just a minute. So actually, many of the cancer are preventable. So there are many scientific researches already going on, already have gone, and it shows that almost half of all major cancer cases, either the manifestation of poor life cycle choices or the pre-cancerous lesion that could be detected even before they present themselves as tumors. So understanding cancer as a disease and practicing necessary preventive measures help in lowering the risk of various types of cancer. So it either can be prevented or you can detect it earlier, and the treatment is very good and intent is curable. So, but you need to know the 100% cure is, cancer cannot be prevented 100%. So, but managing certain controllable risk factors can lower the chances. We all know few of the risk factors can cause cancer. So let's talk about all these things. Few of the cancer, I must say 9 cancer can be prevented, like breast cancer, cervical cancer, colorectal cancer, head and neck cancer, lung cancer, ovarian cancer, prostate cancer, skin cancer, and testicular cancer. So we'll come to the each cancer one by one. So what is preventive oncology? Preventive oncology is a special discipline in oncology that focuses the key measures that can prevent cancer development or delay the progression of the malignant process. So cancer prevent measures can be taken on the major levels, on the 3 levels. So first thing is primary cancer prevention, whether it identifies the cancer causing factor and reduces the risk of cancer formation. This is achieved through alcohol and tobacco cessation, obesity management, vaccination, practicing a healthy lifestyle, etc. Number 2 is secondary cancer prevention. Cancer already happened, so it's focusing on detecting cancer before the onset of symptoms when it is likely to be treated successfully. Screening is one of the major secondary cancer prevention measures. Next is tertiary cancer prevention. It focusing on delaying the progression and preventing the complication like secondary malignancies once the disease has become symptomatic. So first is primary cancer prevention, secondary cancer prevention, and tertiary cancer prevention. So what is cancer screening? Cancer screening is a collective term given to a series of medical tests performed on asymptomatic and apparently healthy individuals to check for the presence of precancerous lesions. Generally, screening is done for the cancer of breast, colon, and rectum, prostate, and cervix. First, come to the breast cancer. Breast cancer is a leading cancer for women. So you cannot prevent the breast cancer, but you can identify at the earliest, and earliest breast cancer detection can almost cure your disease. So every female should know about their breast and its whether it's a vulnerable stage or if there is a lesion at the earliest. So your risk for breast cancer can change over time due to factors such as aging or lifestyle. Simply being female is a primary risk factor for developing the disease. But you should know breast cancer also can happen to male also. So we have received many breast cancer in male. So medical experts advise the following to maintain good health and lower your overall risk for developing breast cancer. So a few steps you can take to reduce breast cancer risk. First is adhere to healthy diet. So diet should be very healthy and rich in vegetable antioxidants and protein, and overall balanced diet is required. Next, maintain healthy weight and body mass index. It's closely related to developing breast cancer. Limit alcohol consumption, smoking, stay physically active, regular exercises, breastfeeding. Breastfeeding means you need to feed your child properly, and the recommended dose as advised by your pediatrician. So talk with your doctor if breast cancer runs in your family, because there is a link between hereditary risk of breast cancer. So what is the screening? Breast cancer screening is done through clinical examination and mammography. These two things only can detect whether breast is under threat. So clinical breast examination, clinicians will do. It involves a detailed evaluation of history, physical examination of breast and underarm regions, palpation of breast in different positions, and examination of lymph nodes. So breast cancer not only involves on your breast tissues, but surrounding tissues are also involved, like axillary lymph nodes, neck nodes, and all. Then mammography. Mammography is an imaging technique. So X-ray radiation, it's a kind of X-ray radiation to detect precancerous and cancerous growth in the breast. It detects the smallest tumors and other abnormalities that are missed during clinical breast examination. Some non-cancerous lump or tissues also can be seen in mammography. So they need further investigations like biopsy. And some of the time, many times, I must say many times, mammography also cannot detect cancer. We have seen many patients, mammography shows negative result, still the patient is having clinical lump over the breast. There is another method called self-breast examination. Every woman should know all these things. So at the earliest, clinical self-breast examination was a routine work for women. But nowadays, there is a great debate, and some of the organizations are saying self-breast examination has no role, and some of them are for it. So self-breast examination is an inspection of your breast by using your eyes and hands to determine if there is any changes to the look and feel of your breast. So how it's to be done? So let's see about the debate. The two main organizations who are dealing with cancer, the American Cancer Society is no longer recommend breast self-examination as a screening tool for women with an average risk of breast cancer. If you say why, then they have studied a huge number of patients. They are doing regularly self-breast examination. Still, the negative is not that much satisfactory, because with time, with some, you can say some form of physical activities or some other issues, like some other issues, like when there is a periodic cycle is going on. Sometimes in a life, every woman would be having a breast lump. So it doesn't mean that lump is cancerous. So they will go for tremendous mental pressure, and they will develop anxiety and a lot of mental stress. And next, they will go for biopsy. And if they found there is no malignant tissue over that particular lump, so then they will be upset again. Why we have done investigations and invasive investigations, and it may develop cancer again in the future. So that's why they have stopped recommending self-breast examination. But breast cancer organization still believes in that. So what they're saying, let it be, but that is costless, effortless examination. Every woman can do, and every woman can see their breast and know their breast. And if there is anything like malignancies sign, then they can go to the doctor at the earliest. So whatever it is, how it is to be done. So there is a five-step guidelines. So first step one is only by eyes. Step 1 and 2 is only by eyes. So you need to stand in front of a mirror. Your shoulders should be straight and arms on your side. Then you need to look for it. What you look? So you need to look the size. You need to differentiate the size, shape, and color. So if there is any abnormalities on them, you need to call a doctor. So and other things, you need to see that breasts are evenly shaped without visible distortion or swelling. If any abnormalities on them can be, so any lump is usually visible. So if you have any discharge, or if you any opening, any distortions, any nipple discharge or bleeding, so you can easily see by clinical examination. Then step 2 is raise your arms and look for the same changes. Same thing you need to see in raising hands. So number 3, while you are at mirror, look for any sign of the fluid coming out of one of the nipples. So you need to press your nipples and you need to see whether anything is coming out, like pus or blood or any discharge is coming out or not. So any milky yellow fluid and water discharge could be a sign of cancer. So you need to see a doctor then. Then step 4. Step 4 is in lying down position. So then the breast will be spread apart. So it will be nicely visible. Now your hand will come into act. So now you need to start palpating your breast. So you need to choose some direction. Either it could be start from the nipple to the surrounding breast, but you shouldn't left any part of the breast, to the neck region, to the axillary region, and underneath of the breast. And the finger pressure will be different at the different site. Like at the lower and the peripheral of the breast, you need to feel it very gently with the pad of your finger. At the middle of the breast, you need to feel more deeply, and the middle and the lowest part of the breast, you need to feel it very hardly, so that you can touch the what is called rib cage. You can touch the rib cage. So different pressure at different levels, but you need to cover whole the breast. So you can start top to bottom, side to side, from your collarbone to the top of your abdomen, and from your armpit to your cleavage. So all of the breast area, neck area, and chest area should be covered by your fingers. Then step 5, many women feel it easier to find it out when they're wet. So do it under the shower. So do the step 4 under the shower. That is step 5. Now see a picture of this palpation. So in this way, in this fashion, you can inspect your breast, palpate your breast. So up and down, you can do it circular ways. You can come into the central way from the periphery, and you can. The best position is lying down position or under the shower. So that you all can practice, but this is the not only diagnostic thing. But if there is any lump, don't panic. Go to a doctor. It may be the normal lump, or it may be the non-cancerous lump, or if there is any discharge or any abnormalities, like nipple is inverted, is discharging, any area is very tender. So breast tender is very common when the woman is bleeding. So other time, if you see any particular area is tender, it's bleeding, or any mouth you can see, then you need to visit your doctor. So no need to panic. Go to your doctor and see your breast, and go for the screening like mammography and USG or MRI the breast. Next comes the cervical cancer. Cervical cancer, you need to know a lot because it's a leading cancer in India. Let's see the statistics. Cervical cancer is ranked as the most frequent cancer in women in India. India has a population of approximately 365.71 million women above 15 years of age who are at risk of developing cervical cancer. The current estimates indicate approximately 1,32,000 new cases diagnosed each year and 74,000 deaths annually in India. So it's huge. And most surprisingly, cervical cancer is completely curable if we detect it earlier. And it's quite preventive. It's quite preventive. It's 100% preventive, cervical cancer, if you know the thing. So main culprit of this is human papilloma virus. It's called HPV, causes 99% of all cervical cancer. So what is this culprit? So let's know about this culprit. There's human papilloma virus, a DNA virus. It's very small, and it has over 100 serotypes has been discovered. Still discovered 100 types of HPV virus, among which 15 to 20 are oncogenic. And most dangerous is two types, that is HPV 16 and 18, which are causing many cancers, not only cervical cancer, many cancers like throat cancer, tonsil cancer, anal cancer, rectal cancer. So these are all types can do. So most we need to know about HPV 16 and 18. So statistics says worldwide high risk type HPV 16 and 18 contribute over 70% of all cervical cancer cases. The most prevalent being HPV 16 is prevalent being HPV 16 in at least 50 to 60% and HPV 18 in at least 10 to 12%. So HPV 16 is the most among all. The lag period between the oncogenic HPV infection and the invasive cervical cancer is 15 to 20 years. That means if you have infected with this virus now, after 20 years, you may have developed cervical cancer. Oncogenic HPV serotypes have also been implicated in the causation of anal, vulvar, vaginal, penile, and oropharyngeal cancer. So it can affect the male population also by penile, oropharyngeal, anal cancer. Okay, so how it transmits? It's a sexually transmitted disease. So it transmits sexual activity, and almost 75% of all sexually active adults are likely to be infected with at least one HPV virus type. However, vast majority of the infection resolves spontaneously, and only a minority, less than 1% of the HPV infection progress to cancer. So research has been shown that it may take 2 years to resolve this virus from your body after infection, but if it stays, less than 1% population, it stays and causing cancer, and that is also cervical cancer. So how to detect this thing is pap smear test. Pap smear test, any women can go for this pap smear test. They will take a sample from inside your vagina, and they will find cellular abnormalities in the cervical tissue, aiding early diagnosis. Majority of the women become infected with HPV at some point in their life, soon after onset of sexual activity. So if you're not into the sexual activity and you're not done your sexual activity so far, so you're less likely to get infected by HPV virus. So what is this pap test? During a pap test or pap smear, samples of cervical cells are collected and checked for irregularities. Precancerous cellular changes can be addressed with appropriate treatment. All women should begin cervical cancer screening at age 21. So it's a diagnostic test done to know whether a woman is prone to get cervical cancer. So if you go for the pap smear test, if your result is positive, it doesn't mean you have the cervical cancer, but likely to have cervical cancer. So you need to go for regular follow-up as you are vulnerable for this. So pap smear test is positive, doesn't mean you have cancer, but you're prone to get cervical cancer. So it's wonder that HPV vaccine has come. So there's two types of vaccines globally accepted, and it's available in India also. That is, one is quadrivalent vaccine, that is Gardasil, and bivalent vaccine, Cervarix. So two types of vaccines are there. So the Gardasil clinical trials have been done with 3 doses, that is 0, 2 months, and 6 months, in more than 1,600 women aged 16 to 26 years from 5 continents, including Asia, have shown 100% efficacy at a median follow-up of 1.9 years against type 16 and 18. So it's 100% efficacy rate with this Gardasil vaccine. And another vaccine is Cervarix. It has got 90% efficacy rate among 18,000 women. It's been trialed globally, and dose is different. So it should be taken 0 month, 1 month, and 6 months. So this 3 dose is all you need to take. But not every woman should take it. So normally recommended age group is 9 to 12 years. It could be extended to 26 years, up to 26 years. Many trial has been done, more than 26 years women has result is very unsatisfactory. So it needs to be taken below 26 years. But you need to know, if you're having sex within this 26 years, then you are not into it. So you need to take it before you have started your sexual activity. So that's why this vaccine is called as a prophylactic vaccine, not for therapeutic use. So you need to take your vaccine as your child, or you are under 26 years of age and not done any sexual activity so far. So preferable age group is 9 to 12 years. So if you have your women child, so girl child, you can say, then you should go for this vaccine. This vaccine has got a very good role. It has a 100% efficacy rate to prevent cervical cancer, and side effects is like other vaccines, like mild fever, the pain and all. It should be given like tetanus toxoid vaccine over the muscles, and 3 doses. So first dose is Gardasil for 0, 2, and 6 months, and for Cervarix 0, 1, 6 months. But it's little costlier, it's expensive. Now there's a few steps by which you can reduce the cervical cancer risk. First one is get the HPV vaccine approved by age 9 to 26. If you are more than that, get a pap smear test to know whether you are vulnerable or not. Don't smoke. Limit the number of sexual partners, because it's a sexual transmitted disease. Oral sex, anal sex can transmit it heavily, and it transmits through skin-to-skin contact and saliva contact. Use condoms, because unsafe sex can increase the chance. Next, come to colorectal cancer. This is not 100% preventable, but earlier diagnosis has some good result. There is a cure for this cancer. So there is a screening for colorectal cancer also. American Cancer Society recommends people who are aged 45 and at average risk have regular colon cancer. Average risk means what? People having a family history of cancer, who smokes, who drinks, not having healthy lifestyle, not doing is very sedentary lifestyle, they are at higher risk group and have regular colon cancer screening. This can include 1 to 6 different tests, either stool based or visual examination. Most popular test is you can say gold standard screening is colonoscopy or endoscopy and fecal occult blood test. So colorectal cancer normally develops from precancerous polyps. Many of us have polyps that can actually develop a colon cancer later. So how to reduce this risk of the colon cancer? Get screened started at age 45. Screened by what? Like this colonoscopy, endoscopy routinely and occult blood test for stool. So get screened started at age 45 or before you have the risk factors. Seek genetic counseling. I will come into later with this. If you have a strong family history, then maintain a healthy diet and weight. Stay physically active. Limit alcohol consumption. Limit consumption of red meat, processed meat, and don't smoke. So these all risk factors are having close affinity to develop cancer cells or feed cancer cells to develop on your colorectal region. Then comes head and neck cancer. Head and neck cancer is also very common in India, very common, and it's been seen that mostly like 75% of all head and neck cancers are related to alcohol and tobacco users. So again, the HPV virus comes into act. It has a great role on head and neck cancer, but for all HPV is not preventable. For male also there is no such vaccination. So these are risk factors. So if you're alcohol or tobacco user like Khoini, this Puria and all, and they used to chew at home all the time. So they're having most of them having head and neck cancer. So recent studies show that head and neck cancer are diagnosed more frequently in younger patients when HPV is present. So how you can do to reduce the risk of head and neck cancer? Get the HPV vaccine. If you are women, get the vaccine at the proper age. So there is a good news for male also. A few countries like Australia have started giving HPV vaccine to male also. At the age of 9 to 15 years of age, they have on trial basis, but still successful. So other countries are definitely will grab into it. So other risk factors are don't use tobacco, definitely. Stop or limit alcohol consumption. Practice safe sex, and limit your oral sex partner because it's sexually transmitted disease HPV transmit through this, and check for your any non-healing ulcer, sharp edge tooth like this. So oral cancer normally develops many patients like you have a tongue bite, you have a cheek bite, you have a sharp tooth regularly, you're getting hard by this, and during in the morning during brushing you have got hard, and the ulcer is not healing. If you see regularly, if you check regularly, ulcer is not paining, but ulcer is not healing. Then don't waste time. Go to a proper doctor and show it to them. You need a biopsy because non-healing ulcer is a sign of oral cancer. And if it detects earlier, there is complete cure of this oral cancer. So mind it, any non-healing ulcer, you need to wait. If you ask me how long I can wait, you can wait for 7 days maximum. If still the ulcer is not healing, there may not be paining, but if the ulcer is not healing, go to your doctor and go for screening. Then comes lung cancer. Lung cancer, as you know, is mainly happens to a smoker if you smoke heavily, but for non-smoker also lung cancer can happen. So we are getting many patients who never smoked, but they can be a passive smoker. They can be it could be a occupational hazard like exposure to other substances at home or in the workplace can significantly impact your risk for developing lung cancer. So if you're quitting this smoking, also can lower your risk of developing cancer. So what are the tips to avoid? Don't smoke, avoid second-hand smoke, avoid unprotected work with the following, like arsenic, asbestos, radon, radiation, radioactive dust. So many of us are working in a hospital setup who are almost regularly exposing to chest x-rays or x-rays. So be careful. So stay safe, stay in a distance so that you are not going to expose regularly to radiation beam. So it can cause your lung cancer. Next cancer is ovarian cancer. It's a female cancer because every female having ovaries are at risk of ovarian cancer. It's not completely preventable, but you can detect it earlier. So according to the American Cancer Society, the risk of developing ovarian cancer increases with age. Ovarian cancer is rare in women younger than 40. Most ovarian cancer develops after menopause, and half of all ovarian cancer are found in women age 63 or older. So if you're at younger age, less likely to have developed ovarian cancer, but if you're menopause, then you're likely to. So regular screening is required. So while you may not be able to prevent oral ovarian cancer, there are behaviors and treatments that lower your risk. What are they? So you need to breastfeed your infant. So nowadays, many of the mothers don't have time, or due to some other factors, they don't breastfeed. So there are some substitutes of breastfeeding they are likely to grab. So this is absolutely a bad idea. So get your child breastfeed your child. Then first birth to give birth to one or more children. Have your fallopian tubes tied or cut. If you are done, then please remove all your fallopian tubes, ovaries, uterus, like this, and take birth control. So THBSO is the surgery nowadays surgeons are preferring after if you're having sufficient childbirth. So take birth control pills and get genetic counseling and testing if you're at higher risk. Higher risk I've already mentioned. So now comes to prostate cancer. Prostate cancer is a very slow growing cancer in male. So regular screening can help and to catch the cancer. So cancer screening can be done to detect prostate cancer at the earliest. So two normal gold standard tests are available. One is PSA test and one is digital rectal examination. So prostate cancer actually is very less common in younger males. So it's very common in older males. So PSA test is prostate antigen specific antigen test. The blood test performed regularly to know about your PSA level. Normally 4 is the level. So if you have more than 4 and gradually it's increasing, then you are likely to get prostate cancer. So there could be many reasons for PSA higher levels. So you need to test it regular interval so that you could know. So your PSA level is increasing steadily. Then you can say I may have prostate cancer or it's developing. So next is digital rectal examination, just physical examination done by doctor to examine any lump or hard region or any other abnormalities in the prostate gland. How you can lower the risk? Adhere to healthy diet, maintain a healthy weight, stay physically active, don't smoke, schedule an annual physical examination with your primary care physician to discuss your risk. Then testicular cancer. Testicular cancer is completely curable, even it spreads to the surrounding tissue. So it's very common in younger age male, as 18 to 39, and most of the testicular cancer is detected in self-examination. So testicular cancer is highly treatable, even if it is spread beyond the testicle, and in most cases treatment leads to remission of cure or cure. Most men who develop testicular cancer don't have any risk factor. So without any risk factor, anytime testicular cancer can happen, but still you can reduce the testicular cancer like this. Perform regular self-check of your testicles to look for lumps, hardening, changes in size or shape, pain or discomfort, or unusual size differences. So it's completely self-check method. Secondly, correct undescended testicles, that is called cryptorchidism before puberty. So if you have that, please go and correct it. It's normally done by surgeons. It's a small operation. Then limit dairy products consumption. One study showed that increased use of cheese, especially cheese, can increase risk of testicular cancer. Then adhere to healthy diet. Then come to genetic testing for cancer. You may heard genetic testing. Genetic testing I have done to know whether I am a vulnerable, I have likely to get cancer or not. So yes, there is a method by which you can get to know that you are having the vulnerable group or not. So genetic testing helps estimate your chance of developing cancer in your lifetime. It does this by searching for specific changes in your genes, chromosomes, or proteins. These changes are called mutations. So for this type of cancer, genetic testing is available. That is breast cancer, ovarian cancer, colon cancer, thyroid cancer, prostate cancer, pancreatic cancer, melanoma, sarcoma, kidney cancer, stomach cancer. So the reason to consider genetic testing for cancer, just to know whether you are vulnerable or not. Like, genetic testing is a personal decision. So you can go and take your own decision to know about your body. So it is also a complex decision, but it also a complex decision. Like, it's a very expensive test. So before going into it, you need to go for genetic counseling. So genetic counseling is that they will counsel you about your risk factor. So you are the high risk group or not. Some of the cancers are hereditary, transmitted. So if you have this in your family, if you are leading very bad lifestyle and other risk factor I've already mentioned, so you need to go for that genetic testing. So ASCO recommends considering genetic testing in the following situation. A personal family history suggests a genetic cause of cancer. A test will clearly show a specific genetic changes. Then you could take decision, the management. So you could diagnose a management of your condition. Like if you found that your breast is vulnerable to get a cancer, so you could remove your breast and all the surrounding lymph nodes. So if you get I'm likely to have ovarian cancer or uterus cancer, so you could remove your uterus just to reduce the risk of your cancer. So you can diagnose and manage your things prior to have the cancer actually happen. Any questions? So I would like to get questions from the audience.
Any question from the audience, please?
The questions can be put on the chat box.
Okay, in the chat box, I can see a question from Aisha Rana. HPV vaccine can be taken after pregnancy, sir?
No. After pregnancy, you can take, but during pregnancy, uh, not so far research has been done. So it's better to avoid HPV vaccine during pregnancy.
Okay, our speaker give the answer. Oh, there a second question is here. It is necessary to have lump on breast. This is done by Modhu Chanda Shorkar.
Yes, normally many women have lump on their breast, but it's not necessary that lump is cancerous. So don't panic. Go to your doctor, and many women in their life can get that lump, but that could not be cancer. So it's not necessary to have a lump, but it's not necessary that lump could be a cancer.
Okay, there is no question. Any question, any participants can ask. Okay, there is no more question. So thank you, doctor. Thank you so much for this beautiful speech. Thank you so much. We know lots of things from this cancer. So thank you. And I would like to call our Women's Cell Joint Coordinator, Dr. Anindita, to say something. Dr. Anindita, please say something. Hello, Dr. Anindita, are you here? I can see you. Hello. Hello. Okay, maybe some net problem is going on. Dr. Kundolika, please say something. She is our joint coordinator in our Women's Cell branch. Hello. Maybe some net issue.
Dr. Shatabdi, please carry on because Dr. Aditya is having some technical issue and we do not have anybody else here.
Okay. Okay, thank you, Dr. Sayantan Chattopadhyay, for your beautiful speech. And I think we know lots of things about our cancer. Thank you, sir, for being here. We are obliged and honored to have you. Thank you so much.
Thank you.
Thank you one and all for your time. And thank you for IAPWC West Bengal to organize such a wonderful webinar for the knowledge of everybody. Thank you all.